So now let us move on to the next part of our video, which is clinical trial. We are discussing on the phase 2 clinical trial on the propranolol drug in newly diagnosed breast cancer patients that will be undergoing neoadjuvant chemotherapy prior to surgery. There were only 10 participants enrolled in this trial. This trial involves the treatment with standard chemotherapy and propranolol. This trial is being done by the previous laboratory work and has shown that the propranolol may decrease the ability for the blood vessels around breast cancer cells to grow, which may be important in helping cancer cells grow and reduce the possibility for the breast cancer cells to spread. These group of patients in a clinical trial will receive 2 types of chemotherapy regimens plus propranolol treatment. The regimen 1 involves paclitaxel, which may be substituted with nab-paclitaxel and given with pre-medication. The regimen 2 doxorubicin, which may be given with anti-nausea therapy, and cyclophosphamide, which may be given with pegfilgrastim. Propranolol starting dose is 20 mg twice per day. However, propranolol dose is up-titrated to 40 mg twice per day to 80 mg daily with chemotherapy depending on tolerability. Tolerability is assessed every 2 weeks. After you complete all chemotherapy plus propranolol treatment, you will then have surgery to remove the breast tumor. Next, we are going to continue with the phase 3 beta blocker heart attack trial on the propranolol drug. The targeted patients are those with one of these diseases and condition: arrhythmia, cardiovascular diseases, coronary disease, sudden cardiac death, heart diseases, myocardial infarction, myocardial ischemia, ventricular fibrillation. The objective of the clinical trial is to determine whether the regular administration of the beta blocker drug propranolol to people who had at least one documented myocardial infarction thus would resulted in significant reduction of mortality from all causes over the follow-up period. The patients were recruited to participate in a double-blind clinical trial within 21 days after the onset of the acute event. One half of the patients were randomly assigned to a propranolol and another one half of patients to placebo. The trial also evaluated the effect of propranolol on incidences of coronary heart disease mortality, sudden cardiac death, and non-fatal myocardial infarction plus coronary heart disease mortality in persons with documented previous myocardial infarction.